people that have nothing to do with either one, but they get in there and they work very hard. So that being said, I think what was happening is people were thinking that you had to be in a clinical field to come and be with health and wellness. And we do want those people, but we wanted everybody. Because you need some people that are worker people that just want to get in there and help, and that's what we needed. The main thing that we did is to get leadership support. So actually, my pastor came to me and said that he wanted to start something in a health field. So he and I talked about this for a couple of weeks, and knowing too that his wife is a pediatrician, so he wanted to start something in the health field to be able to help people, because we knew about the disparities, and we have them right there in our own population, in our community, and where we're located at. So the first thing we ever even did was a health fair. But I'll get to that in a minute. So it was getting the leadership support with the deacons, the other leaderships, and the other ministries in the church, and getting them to go out and talk to them and say, when we're having events, we need you there. We need you to support things. And that helped. It also got some other people interested in joining. So at that time, which was at the very beginning, we had about 30 people. We right now have about 10 very active members that are there every week, every month, at the meetings that really come out and help. But we have some people that just because of their jobs and their families, they can't get there. But they're willing to help. It's just they help in times that they can. So the other thing was researching, when we first started, was researching other health and wellness ministries. And I looked out pretty much nationwide at other churches that had started things like this to see how they started them, what did they do, how did they organize it, and to see if we could use some of the things that they had already used instead of sitting there reinventing everything. And I found one that was very, very active in a church in Alabama, and got a lot of good ideas from them after talking to several of them. But that was one of the things we did. And I told you about trying to advertise to get people to join, and that just didn't work. So it was going to everybody and saying, would you like to be part of this? Then we tried to get a type of idea of what was actually out in our community right there in the Tone Boulevard area that we could actually focus in on, because the first thing we wanted to do was a health fair. And we got some help from Blue Cross Blue Shield because they have, by zip code, a lot of the disparities that are in those areas. And so we were able to kind of focus our health fair on those type of disparities. But they're pretty much citywide. They're not too much different. When we talk about diabetes, when we talk about hypertension and other things, they're pretty much the same. But we did focus in on those type things. Then you'll find in your folder that Valencia passed out, I gave a little bit of information on that first page. What we looked at is what would be the best scripture to identify with our ministry. And we went through about 4 or 5 different scriptures that the ministry gave to me, the different members, and then we kind of looked at them, voted on them, and then ran them past our pastor to see what we thought. We came up with 1 Corinthians 6 chapter 19 through the 20th verse as our verses for our ministry. The next thing was, how do you describe the ministry? What's important about it? What are you focusing on? And that's the description there. I'm not going to read that to you, but we got, I definitely want to hear Catherine's information, and we want to get out of here about 12. So I'm not going to read anything to you, but I want you to look at it because this is what we did when we were trying to get the basics outlined. We wanted the goal. What's the goal of our ministry? What are we actually going to try to accomplish with this ministry? What's the vision? Looking at what our church vision was and how we could relate to that vision. What are the objectives? What actually are the objectives that we want to accomplish within the time of our ministry? And then how do we want to be community involved? One thing that he Pastor Wilson did say is, we want to have the health and wellness ministry for our congregation, but we don't want to sit right here in this church. We want to get out to the community. So what's going to be the community involvement? So each year when I turn in my budget and my information, I always have a mixture of what we're going to have for our congregation and what we're going to do with the community. And one of the things that's been on there from pretty much day one has been the minority health care. Now we've got other things because of this group that we put on there for our community events. So those were the ways that we basically looked at the beginning to have something to when we were talking about the ministry and when we were going out and trying to recruit or trying to put different ideas in different people's minds about the ministry, what was our goal? And I guess I get that from my background in Blue Cross. You can't really try to promote nothing if you don't have a vision and a goal and objectives that you're gonna do. So that was pretty much a given that we was gonna have that. Next thing was budget. So like most of us, money was very slim, but we were startup, but we had nothing. So we had to kind of beg around and maneuver around to get the things we needed, such as blood pressure cuffs. We had to have supplies and things to do our finger sticks and stuff like that. Of course, there was nothing there. But I think the only thing we could find that was there was a old first aid kit. So that being said, we had to pretty much start up from the ground. We started off with a very slim budget, but we were able to get a lot of volunteers to help us with stuff as far as getting supplies and things. So we got that budget. Now our budget is pretty stagnant, and we've been able at the end of the year, and I usually do this at the end of the year, is give a summary of what we've done, what money we've spent, what was our outcomes from the actual events that we did, such as the minority health fair. How many blood pressures do we actually do? When we do our CPR class, how many people do we actually have that came and participated with CPR? When we do our Young Women's event, we do that once a year, how many young ladies do we actually have come to the event? Because that's a free event, most of our events are free. So that's a free event, so I spent a lot of money, but what was the outcome? So if I had 50 girls or 75 girls in the community that came, that was a good outcome. Anything that we do, I try to make sure that we give a count of what we do and how much money and anything else that we do, because I want to, at the end of the year, go back and show. Well, the main reason is because I'm going to usually need a few more dollars, and I want to be able to show what I did with those dollars before, and this is what I want to do with them in the future. So the budget was a big thing. Collaborating with other organizations. So before we even started this wonderful group, we were trying to go out and collaborate with a lot of different other churches and other organizations, such as the American Heart Association, American Diabetes Association. We had several of them to come and give different presentations. We also, Blue Cross was a very good sponsor. They came in and helped us with one of our health fairs. And in that health fair, we actually did close to 150 asthma screenings, thanks to them letting us have people come out and help us with that. Now, we were able to give gift cards too, thanks to them. So it was very easy to get people to come in and get those asthma tests done. So things like that is the way that we try to collaborate. It's been easier now because with Chris being able to send things out, and I'll give you an example. We had a stroke program, a stroke awareness program a few weeks ago. And it turned out to be a big success because we did get it out to all of the churches.
Last Saturday.
Yeah, it probably was last Saturday. And it was a half-day event. Had a lot of great information from a physician, and we also had the stroke team from Erlanger to come. So, and Chris dropped by for a little while, but we had a lot of participation from the different churches because we were able to get that information out. So I think that's a good avenue for getting anything out to get a lot of good, before we didn't get a lot of participation. Because even though we send it out on the radio, Latrice would get it out on her show and several others, we'd have a low participation. So that was making our numbers not look so good for the money that we was asking. This way we've been able to advertise and get more money in. The other thing you'll notice in there that I gave you is we have a monthly meeting. I've made this do we have everybody show up every month? No. But we have enough that we can have a meeting. And in that meeting, basically, we go over any of the events that we've already done to see where was some areas we can improve, and whatever our events are coming up, such as October's a huge month for us because we do a lot of breast cancer awareness events. And this year, we're actually collaborating with Olivet and with the other troops. I just went out ahead. But we're going to have a concert, and we're going to have a mammogram, of course, the mobile unit, and then we're going to have a Peak Sunday to acknowledge all of our breast cancer survivors. So that being said, we wanted to make sure to collaborate more with these big events that we have. Some of them are small, but the bigger events to collaborate with them. And that's what you see on the agenda. And this is the agenda pretty standard to what we do each month. And then I think I put in your packet an example of our newsletter. So we put information out on our website, but of course everybody doesn't get to see the website or may not take time to go out and look at it. So each month we do a newsletter. And in the newsletter, we try to pick whatever the topic is for that month, such as what Sharon was saying for November will be Caregivers Month. So we'll make sure to put something in there about caregivers. This past month, we put information in there about the stroke program. Of course, October is given. We're going to put information in there about the breast cancer awareness, but also about domestic violence, because it is in there. So this, we make sure that this gets out to all of our, we put it in the bulletin, and we also put it in the announcement. So therefore, it gets out to all of our congregation. I share this with 2 other churches. One that's not even in this area, they're in Jackson, Tennessee, and they actually use the information because it's stuff that they can use for their church too. So they actually use the information that keeps them from sitting there recreating something. So those have been some kind of ways that we have worked with our health and wellness ministry that I feel like it's really made it come up to the forefront of a lot of the ministries, mainly that we have there at church. Because what we also found out is if you don't keep events going and keep telling people things that you're doing, you get kind of lost in the shuffle. And we've made a big point of trying to do that. But again, I've got about 6 to 8 people that work very hard with me, and they do a lot of good work. So I got to say, I put a lot of it on them. I bring the ideas, but they actually make them come to events. Like we're getting ready to have one in about 2 weeks. No, in November. We will have one in November, and I will make sure that this group knows about this, because it's going to go community-wide, and right now I really can't share it because it's touchy, but it is something that's going to be for someone in this community, not necessarily for a church, but for a community person. That's all I have to say. Any questions?
Yeah, take a couple questions. Any questions, y'all?
So I have a question. How do you guys select your topics per month? Because you haven't read your newsletter.
That's a good question. So 2 ways. We have actually, she asked how do we select our topics for the month. So we do it 2 ways. One way is we actually put a survey out to our membership and ask them what do they want us to talk about. And we have a lot of things that doesn't hit what we would have thought would benefit topic for everybody, that maybe something that's going on with them that they want us to put in there. I think we had someone that has cystic fibrosis. So they want us to put something in there about that. So we asked the congregation. The other way is we look at the national awareness days and months, and we pick one from there. So like January is cervical cancer month, October is breast cancer month. If there's anything in there that's going to relate back to minorities, we always put something there about there. There's a sickle cell awareness day. So anything like that is the way we pick them. And then we just go in there and try to get the most up-to-date information, usually from the CDC.
One more question. When you have your monthly meeting, of course you guys have to see how you can present better, how you can better serve the community. My next question is, do you receive feedback from the community on how you can better serve?
Good question. So what Valencia asked is, do we give feedback on how we can make whatever program we just had better, such as a survey. We had not been doing that. We started doing that actually this year. And we did, the first one we done was at our girls conference, and we got a lot of good comments back. It's always going to be a comment on the temperature of the room and food, no matter what. It's gonna always be one of those. But we got some good insight from those young ladies. And the ladies that we usually do that on is from 13 to 19, excuse me. And they gave some good comments on some topics they wanted us to. Some of them we're not going to be able to do, but for some of them get too much into the sexual part. But they gave us some good topics that we're going to actually try to have people to kind of speak on for this year.
We'll talk about it.
Any other questions? Hey y'all, this is what this is about, okay? So the handouts, again, nothing is proprietary. We want to help you to build a health and wellness ministry in your church. So our next presenter is Miss Catherine G.